If flying following a particularly nasty flu season is unsettling to you, you are not alone. A new study shows just how closely you need to be sitting to a sick airline passenger to catch their bug. So we brought in Dr. Ryan McCorkle, an emergency medicine physician at St. David's Medical Center, to talk to us about this. He's also a dad, so he gets the whole germophobia thing that us parents have, right?
Absolutely.
Thanks for being here.
Thanks for having me. I appreciate it.
Okay, so how closely do we need to be sitting?
So there's a new study out where they looked at how close you needed to be to somebody to be spread by air particles. And it needs to be within a row. Row in front, row behind, row beside you. You can be exposed if someone is actively coughing into the air. Also, you can be spread by the anyone who's on the airline staff that's passing through the cabin, handing you drinks and things. So that's why hand sanitation is a big key. Maybe keep some hand sanitizer, because that can spread infection too.
So are there other things you can do? I mean, I feel like I was that mom. I wiped down, you know, you try to wipe down stuff. They do try to clean the planes in between flights, but let's face it, I mean, they're packing them in and out and getting people in and out pretty fast.
Sure. So you being in charge of your own exposure is probably the best thing to do. I think we've done a good job with public health outreach, teaching people to cough into the crook of their arm and not into their hands, and then touching things and spreading things. I think that's key. Also, you can take a mask with you. You can get them at any of the drugstores, one of the little surgical masks, if you're feeling ill, so you can help your fellow passengers out, and also to limit your exposure from everyone else.
That's what I wonder. Does it help keep other people's germs from getting you?
Absolutely. Works both ways. Be considerate if you're sick, and you can wear one as a precaution too when you're on a plane.
That's really good to know. Okay, so the airline workers themselves, I mean, obviously they're handing out drinks and things like that. Do we have to worry about that?
The airlines are pretty strict about not letting their cabin crew travel when they're sick, just for this reason. Because one cabin crew person can infect 7 or 8 people on a flight by handing them drinks, cans that they've touched. So I think the other thing too is when you touch things that other people have touched, don't touch your face.
Yeah.
It's so hard for people to remember because we do it so absent-mindedly constantly throughout the day.
Absolutely.
So try, hand sanitation and limit how much you touch your face.
I always wonder because the air, I think, just tends to recirculate in an airplane. So, I mean, is it possible to, if you're on a long flight, like you talked about a long flight you took, I mean, is it possible to be exposed to more things because of that?
So that's been the prevailing wisdom for a long time, all the recirculated air on planes. When they did the actual research, they didn't find that to be the case. It was really your proximity to somebody else who was sick. It's not really the recirculated air of someone who's far away. If there's someone sick, 6, 7 rows away from you, you're not being exposed to the recirculated air. It's just your proximity and those what we call aerosolized particles.
Okay, that's really good to know. Doctor, I appreciate you being here.
Thanks for having me.
I appreciate it. We're back after this.